healthcare industry. We will be highlighting the work done in this segment in the past, current hot trends, and future growth and development scenario. We have on our panel Jayaraman Raghuraman, who is our VP Sales North America, Avinash Birnale, who is our VP Technology, and Ajay Gabale, who is our AVP Technology. We will have a 50-minute session by Raghu and then 10 minutes to answer the questions raised by the attendees. Now I would like to hand it over to Raghu to carry on from here. Raghu, over to you.
Thank you, Ambika. Good morning, good afternoon, good evening, everyone. My name is Jayaraman Raghuraman. People call me Raghu. I have with me today Ajay Gabale and Avinash Birnale to help me with this webinar. A warm welcome to each one of you as we jumpstart this webinar. The topic for today is mobility in healthcare. Over the past few years, there have been rapid advances in both mobile and wireless technologies, growth of new mobile devices, as well as initiatives to include e-health, information technology, and really bringing healthcare to modernity by involvement of automation and ensuring that cost of healthcare provided to patients all over the world comes down. So that's what we will examine today. Before I start, as with any material and any presentation, we at Endeavour are a small part of this evolution of mobility in healthcare, and we are still a student as well as an innovator, and we have used ideas, products, and solutions which whom we follow in this presentation, and all the ownerships of ideas, products, and solutions referenced in this presentation belong to the companies and the people who have created them, and the incredible work they do that is being done in terms of mobility all across the world. The vision for today's presentation is to explore the immense increase of mobile technologies and its increasing use in healthcare. Over the next 50 minutes, I'd like to cover the growth in mobile technologies and devices, and how can we leverage this growth in healthcare? What are the advances which is happening? What are some of the opportunities and some of the innovation that's happening in research labs all over the world? We will then look at some examples of innovation. In such a short webinar, we can't cover everything which is happening, but giving you a gist of some innovative companies who are looking at mobile solutions in various aspects of healthcare, as well as showcase some of our work at Endeavour Software Technologies in bringing mobility into the healthcare industry. As a value to you, this 1 hour, we hope will help in generating ideas in use in your own business, in your own company, as well as probably pique your interest in probably getting to know more about the advancement of mobility in healthcare. We hope you also evaluate our work in mobility, and if there is an opportunity for us to help you in any one of your work in terms of mobility in healthcare. So jumping ahead into the presentation, let's look at the tremendous growth of mobile technologies and devices. Currently, there are over 4.6 billion mobile phones worldwide, amounting to about 3.6 billion users. And even before I say the statistics, it is growing. So this growth is phenomenal, and it is expanding rapidly. And we will have another 2 billion cell phones, smartphones globally over the next 6 years. Out of these, 46 million people in the United States own smartphones. And you combine that with other cell phones, 90% of households currently in the United States own either a cell phone or a smartphone. And last but not the least, 91% of Americans keep their handset near them 24 hours a day. I know I am one of them. Now, this growth is not just here in the US, but it is global. Especially, there is a tremendous growth in developing countries, in the Asia-Pacific region, in Africa. Recently, I read an article which said there are 660 million users in India who have cell phones. China is not a saturated market. Even this year, we have 89 million people in China getting a new cell phone. And Africa is another growth story. So the worldwide penetration of mobile phones, which was 60% in 2009, will grow to almost 2/3 or 75% in 2013. And this is just in the mobile phone and cell phones. Now add to it the number of personal computers, laptops, tablet devices. You are talking about 500 million PCs, 4 billion cell phones, 50+ billion devices, which has an ability to communicate or receive data with data ports. And there was a report recently which said a 10% increase in mobile phone adoption results in almost a 0.8% increase in GDP per person. So the mobile phone of today is being used to transform livelihood of people all over the world. Combined with this is the tremendous growth in the use of internet, in the use of messaging, and the explosive growth of data through mobile devices. As this slide says, about 60% of US subscribers use some form of mobile data services in 2009. And there are more than 257 million data-capable devices. And in January, Gartner published that more people will access the internet, the web, by phone rather than the PC by 2013. And this has already affected the data transmission, and there is going to be a 5,000% data increase in 5 years. So to summarize, incredible growth of mobile devices, the use of internet on mobile devices, the use of messaging. When you come to healthcare, the growth of mobile devices in healthcare is also increasing substantially. 72% of US physicians currently use smartphones, and it has doubled in just a year. With the advent of application stores that you can get with the use in smartphones such as BlackBerry, iPhone, Google Android, Windows Mobile, physicians have started using medical applications at least 50 to 20 times a day, and we will examine it later in the presentation. What is more important is the opportunity for us to reach chronic disease patients, where about half of them have cell phone access. And almost 80% of adult internet users seek some sort of medical data online. So the opportunity is immense. This is These are two charts which talk about the worldwide smartphone market share and the growth they are having, as well as age-wise ownership of cell phones, which gives us an ability to reach aging population. And this is a graph of how chronic condition people are using or either going online or receiving texting messages or sending text messages, which gives us an opportunity to use it for healthcare outcomes. Let's look at how can we leverage this tremendous increase of mobile devices, the use of mobile internet and messaging in healthcare. And the changing environment. Until now, what has happened is that we have had independent medical devices for each function. With the whole advancement of healthcare information systems, EMR systems, in the past they were not integrated, but there's tremendous progress towards better connectivity and communication and seamless integration. Data which was collected manually across the world, now we have an opportunity to use different devices to collect data and analyze them. And until now, care was limited to hospitals, clinics, and healthcare providers. And with the advent of telecare and telemedicine, there's an increasing need to bring care to the people at their home and not have all of them having to come to a clinic or a care facility or a hospital. And how can technology help in that? As you know, the hospitals are increasingly going wireless, and that gives us an opportunity to really bring in mobile solutions. So what are we progressing to? We are progressing to better connectivity and communication between healthcare providers and patients. We have open systems today which enable us to build platforms which help solutions to connect to external health walls, connect to EMR systems, connect to a patient, a doctor, a healthcare provider, as well as medical device manufacturers and others. So today, if you are monitoring any patient vitals through a hospital device, you have an ability to send that information to other systems, to other health records, and leverage it. Finally, we are progressing to disease management and monitoring, really looking at how can you use technology to prevent or manage lifestyle diseases through better control of exercise, diet, and medicine, and the use of mHealth and telemedicine for the same. Last but not the least, can you measure better so that you can influence healthcare outcomes positively? Going on, the areas where there is tremendous work happening in the adoption of mobility can be divided into these areas. One is biometric data monitoring. Can I collect patient vitals through either their blood pressure monitors, blood sugar monitors, or even in-body implants of smart band-aids, which has an embedded cellular strip and being able to act on the data which you get, which can be as simple as saying, okay, this patient's vital is beyond the boundary limits, and can I get some care to this patient at once? The second area where mobility is very useful is to treat chronic disease and wellness. Again, the cost of healthcare is going up. Can I manage chronic disease patients and reduce the time for care as based on timely real-time data, as well as provide wellness solutions so that you can prevent emergency attacks, which increases the cost dramatically. We talked about home telecare for the elderly. As populations in developed countries age, the lack of sufficient medical professionals, as well as the increasing cost, really gives us an opportunity to use technology as well as mobility to take care of our elderly. Then we are talking about hospital and clinical solutions. Healthcare workers as a profession are mobile. And can you expand the current hospital and clinical solutions to be truly mobile so that nurses, doctors, physicians aides, hospital administrators can use hospital solutions, clinical solutions on the move, whether through the use of mobile smartphones, whether through the use of tablets, or even desktop solutions which help them in terms of healthcare. We talked about influencing provider and patient outcomes. And here, there are a lot of companies which are looking at, can I influence patient behavior? If I have an asthma patient, can I get him or her to use an application so that they understand what are the triggers in which I get an asthma attack? Can I keep a log of my medicines I take so that I don't have to worry about remembering everything that I need to tell my doctor once in 3 months when I visit him or her? But can this data be captured and can be transmitted to the doctor so that the doctor has this information even before the patient arrives? So really an integration between doctors, healthcare providers, and patients. mHealth, or healthcare in developing countries, and reaching the masses in terms of health data collection, need for vaccines, need for pandemic or disease epidemic outbreaks, have been used very successfully in terms of NGOs, healthcare organizations such as the UN Foundation and others, where a cell phone is the basic device which can be used to trigger and collect this data. Last but not the least, can the smartphone or any phone can be used for education and reference in terms of education to doctors, education to patients, education to providers, and we'll see how that is evolving and advancing in the industry. This is, I'm sorry about the transition of slides, it's a little slower. In terms of a vision for mobility in hospitals and clinics, today the American Recovery and Reinvestment Act, or the healthcare bill as we know, has earmarked almost $19 billion to the acceleration of health IT systems by doctors and hospitals. And this is a small vision of where we see mobility in healthcare. When you look at the entities in a hospital or in a clinic, you have the physician who needs to know his or her calendars and appointments, needs to be alerted on any medical events so that care can be given quickly. A doctor may need to know a patient's history before visiting with the patient. As well as from an education perspective, can I look up quickly medical references on a smartphone or in a tablet device? So in a hospital, you have a physician going from patient to patient, going from treatment center to treatment center. Mobility is an excellent way of sharing this information with the physician. Similarly, with a caregiver, can a nurse or a physician's aide look at what tests and medical alerts are needed? What is the job schedule? Can I raise a drug requisition to my pharmacist and ensure that it is given? And then you have the admin connecting with healthcare providers, insurance to ensure that claims are given, looking at what is the demand and capacity in a hospital for hospital beds, examination rooms, scanning devices, and really track the usage and ensuring that needs are met quickly. Then you have the lab technicians in terms of probably looking at physician instructions, and even tomorrow ensuring that you can take images of lab reports and send it to a physician or a caregiver so that they don't have to go to a nursing station or a doctor's office to look at it. Last but not the least, can we help patients in terms of test results, in terms of them tracking their disease or their patient history, looking at the medication regime, getting reminders for their pills and medication, and really get real-time coaching for the management of their specific condition. Last but not the least, simply even being reminded of appointments. Going on to bringing healthcare to the masses, this is a term which has been defined and used both in terms of healthcare services as well as to denote the use of mobile technologies in healthcare, which is called mHealth. And this is an integration of health services, e-health, which is the adoption of health IT, telemedicine, and others. And thanks to Vital Wave Consulting, which who published a report last year, which I'll encourage each one of you to download from their website, on the adoption of mobile health and the advances of mobile health all over the world. When you look at mobile health and you look at solutions across the healthcare spectrum, you are looking at using very cheap technologies. An SMS in most developing countries costs less than a penny a day. And can you use that in terms of education and awareness in terms of disease and health control? Can I use the cell phone for data collection and record access? Can I use it for monitoring and medication compliance? As well as, can I use it for really disease and emergency tracking with other mobile communication devices? Last but not the least, can I give access to my staff and information who are via mobile devices for diagnosis. One trend which has really accelerated the use of smartphones is the application store, whether it is the BlackBerry app world, whether it is the iPhone app store, whether it's the Google Android market. Today, you can get hundreds of applications which you can download in variety of areas of healthcare. In the Apple Store, you have 3 different categories: fitness and wellness, healthcare, education, which really has applications which developers have developed for a variety of uses, whether it is for me to look at managing my diet, managing my exercise control, getting the latest videos of what I need to do to exercise better, or it's healthcare in terms of, can I get information on various drugs? Can I get videos on how to manage a disease and get educated in terms of healthcare? There are hundreds of applications. Now, this has really given an opportunity to new breed of organizations, mobile technology companies, as well as established companies, whether it is Pfizer, Abbott, Johnson & Johnson, who are looking at how can they expand their knowledge of their products, solutions, devices to patients, to doctors, to healthcare providers through the growth of this healthcare business application. And these uses features, whether it is location-based, whether it is the camera in the smartphone, whether it is video, or even voice and phone in terms of ensuring that you can get help when you need. And this trend is going towards, here we at Endeavour are looking at how hospitals are looking at how can they use some of the smartphone applications to influence the patient, whether it is as simple as having a directory of various doctors, physicians, and their location within a hospital, a large hospital, and helping a patient or a visitor to the hospital find what they are looking for quickly and efficiently. Let's look at some of the examples of innovation in healthcare using mobile solutions. I talked about the immense growth of mobile devices. We discussed how that can be used in terms of use in healthcare and the opportunities and the advances we are seeing. Now let's look at some examples of organizations which are innovating using mobile solutions in healthcare.
I can hook it
One
up.
of the companies
Let me hook it up for you. It's just boring.
whom we follow
the guys,
at Endeavour, they are not our customer. They are not related to us in any way. But in a way, MedApps is a company which is looking at really bringing remote health monitoring systems to connect patients with their families and care providers by providing an easy-to-use remote health monitoring solution. To take a quick look at this, a patient may use a pulse oximeter, may use a glucose meter to measure their sugar, may use blood pressure monitors. Can all of these data be collected by these devices and without a patient's intervention sent to a personal health device, which MedApps calls the health pass, which transmits this health reading from these off-the-shelf medical devices to MedApps servers, and based on results, really give you, integrate with their web portal, which they call the HealthCom, and then there can be triggers based on the collection of this data, so that you can either call up a telecare provider or you can call a 911 emergency to help the patient, so that cost is down. And this is an hands-off telehealth solution. As you know, a lot of countries in the world do not allow manual intervention or of data which is collected from a patient. So this gives a hands-off telehealth solution, and this can be transmitted to mobile smartphones. And MedApps is an innovator in this. Similar to MedApps is one of our customers, WellDoc, which is a healthcare technology company out of Baltimore, Maryland. And their mission is to influence lifestyle disease management through influence of preventive care for, let's say, diabetes. So a diabetes patient needs to manage their diabetes, their blood sugar levels, their medicines, as well as their exercise and diet. And can patients be given a smartphone application or a cell phone application where they can manage their disease, and this data goes to an expert system where they get management advice in terms of how to manage their disease, how much to exercise, what should be their diet control. And this, in clinical trials, sample clinics have seen a tremendous advancement and reduction of A1C count. And WellDoc is also pioneering this work in other lifestyle disease, which includes asthma, COPD as well. Here are some smartphone healthcare application. Again, I should admit that for lack of time, we could have taken a lot more. This is some sampling of some of the smartphone applications which are available in the various app stores, whether it's the BlackBerry, iPhone, or others. One is Hippocrates, and anybody in the healthcare industry is aware of the tremendous success of Hippocrates even years back on a Palm PDA, as well as currently on the BlackBerry, iPhone, and almost every device. And this contains drug information of almost 3,500 drugs. It has safety information, what dosages to be taken, and it is used by over 1 million health professionals. And this is an excellent example of using mobile technology in bringing something which is very vital to a healthcare provider or a doctor into close to them on their cell phones. Then you have the New England Medical Journal of Education and Research, where you have an ability to find the latest medical research, review articles, as well as audio, videos, and whatever you got out of their website, it is easily available in this application. Two more examples. The AdScript platform, which was available on the desktop laptop, which delivers critical patient information, including real-time waveform data from various hospital monitoring systems, whether it is the fetal heartbeat, whether it's ventilator flow tracking, whether it's patient's vital signs, EKG data, pulse oximeter. This platform now has expanded to include the mobile phone. So you can provide and send this real-time waveform data to doctors or nurses' smartphones, laptops, or desktops seamlessly.
Huh? Well, what? Tell me what you see.
Another example is the AllScript, which basically controls the electronic health records. So doctors, before visiting with a patient, can bring up the patient electronic record, health record, and B, control. It is connected to the Allscripts Enterprise EHR. EMR companies, including companies such as EMDS in Austin, which are really innovating in terms of e-health and EMR solutions, are looking at the tablet devices, whether it's the iPad, whether it is the Google Netbooks, or even a smartphone like a BlackBerry, iPhone, Google Android, to be able to help clinics and hospitals in terms of capturing of electronic health records and integrating it with health walls, integrating with other office EMR systems. One more example which we are really enthralled by is a company in Netherlands called DigiPen. They have come out or introduced a product which is called a DigiPen. A DigiPen is nothing but a small digital pen where you can fill out, you can fill out forms, paper forms, and it captures the information in this digital pen, which is Bluetooth and GPRS enabled, sends it to a cell phone. So all you need is a cell phone and this DigiPen. It will capture this handwritten information, whether it's a medical form or a medical record, transfer it to a cell phone, and as long as the cell phone has a GPRS system, be able to send to a DigiPen server, and you can convert it into a PDF file or to a open standard digital document and send it to senders and recipients. Here again, this is as we said, everybody has a cell phone. With the use of a very simple digital pen, you are able to reduce operating costs, and you capture medical records at the point of capture without any changes. Two more examples, one on the use of texting in terms of medical health. So this is a project called Project Masiluleke, which was compiled as part of the Vital Wave mHealth report last year. As you know, 1/4 of the population in South Africa are HIV infected, but only 3% really know that they are infected. So this project was started with the goal of sending 1 million text messages a day, or 365 million text messages during the year, to encourage people to be tested and treated for HIV, AIDS, and TB. So this used a very inexpensive form of a text message. Now, as you know, a text message can be of 140 characters. This text message used something called please call me. So you do a please call me along with the phone number, and the rest of the message can be for ads and sponsors. So it was no cost to the receiver of this message, and they had to call the National AIDS Helpline and come in to be treated. And this is again a use of mHealth initiative using text messaging. One more example is in Brazil, data collection times used to take months, especially in the rainy season in the Amazon region. And so to contain the spread of dengue virus, field workers were given a mobile solution in their cell phones, which was connected to a server, so that data collection times can be reduced from months to days. And 400 test results were collected, and the end user acceptance was very high. People found it very easy to collect where dengue virus is spreading and being able to send it through their GPS location information on their cell phone, which the application captured and sent it back to a server. And this was done by the Amazon State Health Ministry and Nokia. Moving on, let's look at some of the work we in Endeavour have done. I talked about hospital management systems and the vision for how we can enable hospitals. One such project we've done in the past included really helping a hospital bring on its overall demand and capacity management solution to a BlackBerry and to a Windows Mobile, where hospital administrators can look at how many hospital beds are in demand, how many are coming clean, how to allocate those hospital beds, as well as examination rooms, as well as doctors' appointments, and really what in the past involved a nurse or a physician's aide or a hospital administrator to look at a desktop to manage the resources in a large hospital, were sent to a smartphone, so that the nurses and the hospital administrators and doctors didn't have to leave what they were doing to get this information. Another one of our work involved working on an anesthesia clinical tutor, which is a smartphone application which we developed for a company called Gashead. And it's been very successful in helping anesthesiologists and anesthesiology students to download this application, and has tools to enter patient vitals, fluids which are administered, and gives you a clinical calculator and gives instant results with guided explanations. And this is available on a variety of platforms, including the BlackBerry, the Palm Treo, the iPhone as well. One of our customers is a new healthcare publisher as well as a medical education provider. And they have tons of information in terms of online information for various healthcare areas, as well as continual medical education for doctors and healthcare providers. We are working with them to build a whole mobile platform so that all these information can be brought onto a smartphone. So if a doctor or healthcare provider has 15 minutes of time, they can watch video, audio, get the latest information, as well as take quizzes to get their knowledge updated. And the first solution in this series is an orthopedic cipher guide, which is available on the BlackBerry App World as well as the iPhone App Store. Another application of mobile devices has been in enabling medical device manufacturers, pharmaceutical companies, their salespeople to get information on the go. One such example is a surgical equipment supply chain sales system, which really helped salespeople look at what inventory they have, help them to capture orders, as well as get marketing collateral, merchandising, so that when they visit a doctor, have an ability to get that information on their smartphone and be able to provide information as needed. This was developed for our customer called Surgisoft and used in terms of various medical device manufacturers. So moving on, these are some of the examples of what is happening in terms of innovation in mobile healthcare. But we should not forget that the regulatory practices and the requirements for the healthcare industry apply to mobile solutions as well. So the specific compliance needs, whether it's the Health Information Portability and Accountability Act, HIPAA, to ensuring that whatever you capture in terms of data follows the HIPAA compliance rules, whether it is the Corporate Integrity Agreements or the Health Information Technology for Economics and Clinical Acts. You need to ensure that you understand what are those requirements and ensuring that you follow these rules. As you know, medical applications, medical devices, anything which involves medical devices and collection needs FDA approval. And this includes software as well. So there may be, for anything which involves a mobile phone and connectivity to a medical device, under the Federal Food, Drug and Cosmetic Act, HIT or a Health Information Technology software is the medical device. Now, there is a lot of work going on in terms of regulations, which is coming up in terms of what sort of oversight needs to be done in terms of FDA approval. And this may be in terms of 3 different levels, where HIT vendors report adverse events in terms of using their application. In the middle layer, it may be compliance with the quality system regulations such as given by FDA. And the highest level, HIT software goes through pre-market clearance, similar to a device, before you can sell or release the software. What is also important is your applications or solutions which you develop has accessibility enabled. In the US, it's called Section 508. In the UK and others, there are other sections which you need to look at. And all employees and developers are required to be certified in HIPAA regulation.
Senior Product Marketing Manager, both.
Going on, some of the regulatory practices involve that you use secure sockets layer. If you are encrypting any information or storing it on a device, you follow the encryption standards, be able to make sure it cannot be compromised. And if you are connecting to health information systems or EMR systems, all the application services are required to follow the same regulations. What are some of the emerging trends in healthcare mobile solutions? One is there is a lot of investments by large wireless and semiconductor organizations in terms of healthcare mobility devices, in terms of healthcare mobile solutions, whether it is a smartphone manufacturer like BlackBerry who are innovating in terms of healthcare, RIM, or whether it is Nokia, or whether it is technology companies such as Qualcomm, as well as health technology companies which are investing in terms of bringing in devices to drive growth of data services in healthcare. Of course, we talked about the evolution of e-health and mHealth, where can you bring healthcare to the masses in the developing world? One such initiative is the West Wireless Institute, which has been sponsored by Qualcomm and Scripps Health, led by Dr. Eric Topol. and its mission is to advance the health and well-being by validating and accelerating the use of wireless solutions for medical and community needs. I'll encourage you to go to the website to read a lot more. Thank you for your time. Just before finishing, let me tell you a little bit about Endeavour. We are an 8-year-old company with headquarters and an engineering center in Bangalore, India. We are worldwide in Austin, with headquarters in Austin, Texas, our North American headquarters, London, UK as our European headquarters. And since 2002, we have analyzed, recommended, and executed mobility solutions for a variety of industries, including healthcare. Whether it's consumer products, whether it is manufacturing, logistics, whether it is sales and marketing, we have done it all. And we are certified on most mobile platforms, including the current smartphones. We have divided our business into a strategic consulting practice, which we call the Mobile Opportunity Assessment, where we analyze, recommend, and help you build a vision and a mobility roadmap for extending your solutions or even new solutions liberating mobility. We, of course, have a very strong product engineering group where we architect, design, develop, and deploy mobile solutions on a variety of mobile platforms. Last but not the least, given the tremendous amount and variety of mobile devices, networks, and carriers, we have a quality assurance group called the Endeavour Quality Assurance Lab, where we undertake mobile test strategy, device application porting, test planning, design, and execution. Here are some of our customers. They include technology companies, startups. They include small, medium, and large organizations who are looking at our expertise in mobile solutions to help them advance their vision. Thank you. Ambika, I am ready to take any questions. If you need to contact me, my email ID is here. You can also write to info@techendeavour.com, and we'll be glad to help you. I hope this hour has been useful to you. Ajay, Avinash, and I are ready to take questions.
Thanks, Raghu. Thanks for the rich information and the enlightening presentation. We have a few questions from our attendees, which I'll read one by one, and then I would request one of the panelists to take that up. Now, the first question from one of our attendees is it possible to use simulation software with RFID or Wi-Fi or cell phone ID location to statistically and quantitatively improve patient flow processes in real time?
The answer is yes. I know for sure that there are several healthcare technology companies which are using simulation software as well as including simulation after capturing of data to influence healthcare. Relating to your question about whether we can use smartphones, sometimes we are limited by what a manufacturer, such as let's say an Apple or a Nokia, will allow capture and transmission. So as long as the smartphone manufacturer allows some sort of simulation to happen and the use of external APIs, we can involve this using a smartphone as well. Of course, I should admit I am answering in an overall specific sense, but based on a specific example, we can examine what is happening out there. I hope that answered your question to some degree.
Thanks, Raghu. The next question is, will these apps limit the users to connect to hospital or healthcare agencies who are hosting these particular applications, or will it allow the user to reach out to easily accessible help in case of emergency?
I think I will answer part of the question. I'll let Ajay answer the second part. What we have seen in terms of smartphone applications is there are two kinds of smartphone applications. One which connects to an already available software solution. For example, if you have an EMR solution which captures visit data on a clinic, then the software provider is now enabling this on a smartphone, or is enabling this on an iPad or on a tablet device, and connecting to the server. In this case, the information goes to the server. There are other applications which are standalone application which allows you to capture. Let's say you have a fitness application. You can decide that you will capture your exercise regime every week, and then you can post it to different online systems, or even send it as an email or share it on your Facebook and Twitter. So I hope I'm answering you in terms of there are various types of how you want to develop your application. You can develop a standalone application, or you can develop an application which connects to a specific hospital system or a healthcare system. For example, we are now working with a hospital which is looking at a patient application. Anybody can download that application and get to know who are the various doctors in that hospital, what are the treatments allowed, how to get there using your location base. That does not have any integration to a backend system. Ajay, do you want to add to this?
Yes, absolutely, Raghu. Definitely, such an application, I think, exists, and it can be done. And it works, as you know, the cell phone works in basically two modes. If you have a connectivity, immediately the information could be sent to the hospital or the servers, and where the action can be taken based on the alerts generated based on your data. And obviously, SMS is the tool, text messaging is a tool where it can be alerted to the caregiver in case of emergency for any kind of emergency situation. So it depends on what are the requirements, but definitely it can be done. I hope I have answered your question.
Thanks,
Hello.
Ajay and Raghu.
Yeah.
Thanks, Ajay and Raghu.
Mm-hmm.
We'll only be able to take one more question because of the shortage of time. The next question is, what kind of applications are there for mHealth? Are these approved by FDA and other regulatory agencies?
Raghu, I would like to take this question and answer it.
Sure.
Yes, definitely there are a lot of applications which are already in the market, which are approved or cleared by FDA, and most of them are data monitoring applications, which doesn't require a lot of efforts to get it FDA approved, because if you collect the data and if you send it to the server, what all it requires is the secure data transmission and secure data storage on the handle. So apart from that, if you are giving any piece of advice to a patient, and that advice could be like medical advice or any other thing, then it requires a little bit effort on the getting it FDA approved. So FDA is actually tightening the screws on these applications which are available already. They are evaluating each of these applications and making sure that they are safety to the patients, just like other medications. They do a stringent process. Similarly, for all softwares, they are doing this process. And we already have our white paper based on our experience created, which you can download from our website. Raghu, you want to add something on that?
Yeah, I just want to add to the first part of the question. There are actually quite several hundreds of applications in mHealth initiatives all around the world. I would encourage you to look at the Vital Wave consulting report as well as some trademark advances which are happening in terms of NGO organizations like United Nations Foundation. In terms of private industry, I'll encourage you to look at the BlackBerry app world. I'll encourage you to look at the iPhone App Store as well as the Android market, where there are quite a few applications either in the use of doctors, patients, in terms of management of your disease or management of your appointments, as well as preventive cases. So there's quite a few things happening. You also have technology publications like mHealth News, which from time to time talk about and publish interesting applications which are in the whole mHealth space. I hope I'm helping you answer the first part of the question.
Thanks, Raghu. Thanks, Ajay, once again. I would now like to thank all the attendees who have been with us throughout this webinar. And also, I would like to thank all the panelists who have provided us the insights on mobility in healthcare. Thanks a lot, everyone. We have a few more questions from our attendees. I would pass on these questions to Raghu, and then we'll send the answers to the attendees who've asked these questions. For more questions, all the attendees can get in touch with Raghu directly, as his ID is there on the presentation. Thanks, everyone.
Thanks, Ambika. Thanks, everyone. Have a good day.